Forgetting a name and remembering it later is common. Getting lost on a familiar route, repeatedly asking the same question, or losing the ability to manage a familiar task is different. Today, we will separate everyday lapses from 5 changes that deserve attention. None of these signs proves dementia. Many treatable problems can affect memory and thinking, which is exactly why early evaluation matters. Thinking ability is called cognition. It includes memory, attention, language, judgment, planning, and understanding where you are. Normal aging can make recall slower. You may need more time to learn a new device or remember a word. The information often returns later, and daily independence remains intact. The most important question is not, do I ever forget? Everyone does. Ask, is this new? Is it worsening? And is it interfering with normal life? Sign number 1 is repeating the same question or story without realizing it. Anyone can repeat a story. Concern rises when a person asks the same question several times in a short period, forgets a recent conversation completely, or relies increasingly on others for information they previously remembered. Keep context in mind. Poor sleep, stress, hearing loss, distraction, and some medicines can prevent information from being stored clearly in the first place. Sign number 2 is trouble with familiar tasks. This may mean becoming unable to follow a recipe used for years, repeatedly making serious errors with bills, forgetting the steps of a familiar appliance, or becoming confused by a routine medication schedule. A single mistake is not a diagnosis. Look for a pattern and a decline from the person's own previous ability, not a comparison with someone else. Sign number 3 is getting lost or confused in familiar places. Missing a highway exit happens. More concerning changes include becoming disoriented in one's neighborhood, not recognizing a familiar route, or having difficulty understanding where one is in relation to home. Driving deserves special attention because vision, reaction time, medication effects, and cognition can all contribute. New dents, near misses, traffic citations, or confusion should prompt a respectful safety conversation and professional evaluation. Sign number 4 is a noticeable decline in judgment. Examples include falling for scams that would previously have been recognized, giving away unusual amounts of money, ignoring serious safety risks, or making decisions that are sharply out of character. Scammers deliberately create urgency and fear, so anyone can be manipulated. But a new pattern of poor judgment, especially alongside other cognitive changes, is worth discussing. Sign number 5 is a major change in language, behavior, or personality. Someone may struggle to follow conversation, frequently use vague substitute words, withdraw from activities because communication has become difficult, or show unusual apathy, suspicion, agitation, or loss of social restraint. Depression can also look like memory loss. Hearing problems can make a person appear confused because they missed part of the conversation. Grief, isolation, pain, and poor sleep can change behavior. Evaluation helps distinguish the possibilities. What can cause thinking problems besides a progressive brain disease? Medication side effects or combinations are common possibilities. Sedating antihistamines, sleep aids, certain bladder medicines, and other drugs can affect alertness or memory in some older adults. Do not stop them yourself. Request a medication review. Vitamin B12 deficiency, thyroid disorders, infection, dehydration, depression, untreated sleep apnea, alcohol use, hearing loss, vision problems, and poorly controlled medical conditions may also contribute. This is why purchasing a memory supplement is not a responsible first step. Evidence for many products is weak. Ingredients can interact with medicine, and the bottle may delay a useful examination. If you notice a pattern, write down specific examples and dates. Bring a current medication and supplement list. Invite a trusted person who has observed the changes. A clinician may review medical history, mood, sleep, hearing, vision, laboratory tests, and cognitive function. Early assessment can identify reversible contributors, establish a baseline, improve safety, and help families plan. Seeking evaluation is not surrendering independence. It is using information to protect it. There is also a difference between gradual change and an emergency. Sudden confusion developing over hours or days can be delirium, which may be caused by infection, medication effects, dehydration, low oxygen, or another illness. It requires prompt medical attention. Sudden facial drooping, arm weakness, numbness on one side, trouble speaking, severe headache, vision loss, or loss of balance can be signs of stroke. Call emergency services immediately and note when symptoms began. What supports brain health over time? No habit guarantees prevention, but several support overall health. Control blood pressure and diabetes with professional care. Remain physically active, protect hearing, sleep adequately, avoid smoking, limit alcohol, eat a balanced dietary pattern, and stay socially and mentally engaged. Mental activity does not require expensive games. Learn something meaningful, read, play music, volunteer, practice a skill, or stay involved in conversations. The goal is a life that regularly uses the brain, body, and social connections together. Protecting hearing deserves special emphasis. When conversation becomes difficult, people may withdraw socially, and the brain must work harder to decode speech. Have hearing changes assessed instead of treating them as an unavoidable inconvenience. The same principle applies to vision. Clearer sensory information makes everyday thinking and navigation easier. Families should approach concerns with examples and respect. Say, "I noticed 2 bills were paid twice," rather than, "You are losing your memory." Choose a calm time, focus on safety, and invite the person into the decision. Shame and arguments rarely produce useful information. Let us review the 5 signs. Repeated questions with lost awareness, trouble with familiar tasks, getting lost in familiar places, declining judgment, and major language or personality changes. Subscribe to Longevity Blueprint TV for calm, evidence-based guidance on staying healthier and more independent as you age. In the next episode, we will examine 5 exercises that are often performed in unnecessarily risky ways after 60, and safer versions that still build real strength. Thank you for watching.